Hi, I'm Dr. Tony Mork, endoscopic spine specialist. In this video, which is part 3 of 3, we're going to talk about treatment options for painful annular tears or toxic annular tears. Well, when we talk about treatment options, we have to address 3 problems. As we've talked about, there's a mechanical problem, a chemical problem, and possibly an immunogenic problem. So the treatment ideally should address all 3. And the answers to this question should guide the treatment. The goals of treatment should be to remove the fragments, change the chemistry inside the disc, and desensitize the small nerves that accompany the healing process. Well, 1, we're going to remove the fragments. 2, we want to change the chemistry inside the disc. And 3, we'd like to desensitize the small nerves that accompany the small vessels when healing. How many of the problems does a treatment address? Can a treatment address all 3 issues at the same time? Well, what treatment options are there? 1, surgical. 2, biologic injections. 3, thermal. Well, let's talk about number 1, surgical. Does it address all 3 issues? Fragment, chemical, and immune response. If the primary problem is the fragments floating around inside the disc and we remove them, then no fragments remain to get stuck in the fissures and tears or generate a chemical or immune response. Surgery performed in a water environment where there's constant irrigation washes out the toxic chemicals, therefore changing the chemical environment. So, a change in the chemistry. What does endoscopic washout look like? Well, here's a picture of an actually endoscope inside the disc. And as you saw in some of the previous videos where we've stained the disc with some methylene blue, the fragments coming out that are stained blue are non-viable fragments, and I'm reaching inside to go toward the nucleus, but you can see that these fragments have migrated out to the periphery as well. So here we are reaching in with very gently and just teasing away tissue, but this tissue is non-viable and therefore not beneficial anymore. The disc chemistry will definitely change with the irrigation during the surgery, especially since pain is chemically mediated. This change in chemistry is very beneficial. Well, what about thermal ablation? What about the hypersensitive small nerves that accompany the new blood vessels growing in to try to heal the annulus? Well, thermal ablation doesn't work by itself. There used to be a procedure called IDET, which was a placement of a thermal kind of a coil inside the disc to heat it up, but it really did not work very well at all. So thermal ablation by itself, not really a great solution. But in the endoscopic surgery, can we deliver a thermal probe to destroy sensitive nerves? Well, the answer is yes, and here's how it looks. Here's actually a thermal probe being passed through the endoscope and touching the disc, actually some viable, some non-viable disc, but you can see where the non-viable tissue is, the thermal probe almost melts it. In more cases where you can see the small blood vessels that are ingrowing into the disc or through the annular tears, this probe is actually able to coagulate, actually destroy the little hypersensitive pain fibers. But you can see how well this works. This probe is maybe 1.5 millimeters in diameter. It's quite small, even though it looks large here. But yes, can you deliver a thermal probe via an endoscope? The answer is yes. And then the autoimmune response is negated by thermal ablation of the sensory nerves. So if the autoimmune response is kind of sensitizing these little nerves, and then the nerves are coagulated or destroyed with thermal ablation, then that eliminates that portion of the pain contributor. So what are the benefits of an endoscopic washout? Well, the fragments are removed, and a washout changes the chemistry inside the disc, and the thermal probe can destroy the small pain nerves that are accompanying the new blood vessels trying to heal the annular tear. In this next slide, we're going to take a look at Janet, who has given me permission to use this to interview her about 8 weeks after her surgery to see what her response to an endoscopic washout as treatment for an annular tear is. Here we go.
My name is Janet Lee, and I was in an accident 2 years ago, a motor vehicle accident, and I went to several doctors, orthopedic doctors. They couldn't help me, had MRIs done, had physical therapy, acupuncture, chiropractic, and nothing worked. Anyway, we sent Dr. Mork a copy of my MRI. He talked to us on the phone for half an hour. It was very easy. And then he says, I really believe I can help you. And so we went down to Newport Beach. And by the time we got there, I was limping. I was stooped forward. And after the surgery, we were walking out of the surgery center, and Dr. Mork and my husband said, "You're walking straight up and down." And it was like, I am. And I hadn't done that in months. I am now 8.5 weeks out from the surgery, and I have a Fitbit, and I'm walking between 10,000 and 11,000 steps a day. And I am thrilled. It's changed my life, and I am so very thankful for Dr. Mork.
Well, let's talk about biologics. Does a biologic address all three problems: fragment, chemical environment, and immune response? Can we change the chemistry inside the disc with an intradiscal injection? The short answer is sometimes. Have you ever heard of chymopapine, the biologic injection that was used to dissolve or discs used back in the 70s and 80s? Well, it might be expected to work since chymopapine actually digests the fragments, and you would think that if you did this that the pain would go away. But chymopapine has not been proven to be effective at treating axial back pain. But here's an example of a biologic that can treat axial back pain. It's a combination of glucosamine sulfate, chondroitin sulfate, hypertonic dextrose, and DMSO in a paper published by Klein and Eck back in 2003. Using this biologic, 57% of people with low back pain improved markedly. 57% marked improvement with an injection, no surgery. So what's going on here? The chemistry inside the disc had to change as a result of the intradiscal injection. The hypertonic solution desensitizes the small sensory nerves. So if there were small nerves involved, the hypertonic solution probably made them malfunction or made them so that they didn't really work at all. If the injection works, it rarely needed to be repeated, so said the study. Here's an example of a person that had a chemical injection like that noted in that study. And here is his response after the injection.
Hi, my name is Andrew Cadiz. I give Dr. Tony Mork permission to use this video. I have an annular tear at L5S1 which caused me a lot of pain for years. Just over a year ago, I was involved in an accident where I was rear-ended at 40 miles an hour, and the pain became worse. I talked to Dr. Mork, and he suggested I get a intradiscal injection. That's not an epidural for the pain. Yesterday, he gave me the injection, and upon leaving the surgery center, I felt no pain, but then again, I was on medication. This is day number 2, and I haven't used any pain medication, and I feel great. I don't feel any pain that I was feeling before, and I'll keep you up to date as to where my pain is and level is, but I don't feel anything, and I haven't felt this great in years. Hi, I'm Andrew Cadiz. I just wanted to give Dr. Mork an update on the status. He gave me an intradiscal injection at L5S1 about 13 days ago. I reported on the first day I experienced no pain. Everything had gone away. On the 12th day, I ended up driving with a friend to Texas. It was 15 hours straight in a car, about 12 to 1,300 miles nonstop, except for gas and grabbing a quick bite to eat. I didn't experience any pain in my low back or my my legs going numb or anything like that. So I just wanted to thank Dr. Mork for everything he's done for my health and me getting back to being able to do things I haven't done in years.
Well, this complete and immediate response to a intradiscal injection is really unusual. It doesn't occur very often, and so I would never suggest that this is the typical response to it. But I think that it really shows that a change in chemistry inside the disc can really eliminate discogenic pain, since pain is chemically mediated. What about radicular pain without a disc herniation? This is one of the questions or in the toxic 12, and it's one of the things that people will call me about. They'll say, geez, I have leg pain, but I don't have a disc herniation. What's going on? And I think that the inflammatory chemicals inside the disc can leak out through an annular tear and stimulate the nearby nerves. So once they come in contact with the nerves, it's the same as a disc pushing. So here we have the dye that's shown in white, and it just pushes out against here and leaks. This yellow is just a symbol for the exiting nerve root. So we can see that if that chemicals came out and affected that nerve root, that there's no disc herniation here, but the nerve could be very stimulated to recreate a sense of pain in the distribution of this particular nerve. Chemical contact with the nerve might feel the same as pressure from a disc herniation, since pain is chemically mediated. As much as 20% of radicular pain is considered to be caused by annular tears. And it might answer the comment, I have leg pain but no disc herniation. In my experience, this situation is almost always caused by an annular tear. Annular tears can cause radicular pain, or they can cause leg pain, thigh or leg or foot pain, without a disc herniation. So what are some conclusions about toxic annular tears? Well, the patient history, also known as the toxic 12, will reveal the problem 95% of the time. And this is after talking to hundreds and hundreds of people on the telephone. They will oftentimes give a very consistent history and oftentimes mention one of those toxic 12 comments. The MRI is not a good way to image annular tears. As I've said, oftentimes the annular tear will not be seen in a disc bulge, but once the CT and the discogram have been done, you can see the annular tear in spite of a completely negative reading on the MRI report. CT discogram is the gold standard to image an annular tear, and I realize that there's an awful lot of pushback and controversy about the use of a discography in this day and age. because of a paper that was published in the early 2000s in people that had some very minor low back pain, and there was some evidence that that there was some additional possibilities of disc herniations occurring 10 years after the injection. So it was a very nicely done paper, but I have to say, in my experience, I have never seen any kind of disc herniation at 10 years out, and I've talked to other experienced clinicians who have not had any problems with people many years after their discography. Most annular tears don't hurt, but the toxic ones do. The fragments are the problem, in my opinion. The fragments can cause mechanical problems. So when people say, oh, my back went out, that's what probably the fragment moving in and out of the wrong or the right position. They can cause a chemical problem as they come in contact with the body's defense system and can generate some significant inflammatory agents like we've talked about. And they can also be responsible for an immune response and sensitivity of the nocioreceptors that accompany the small blood vessels sent in to heal an annular tear. So the ideal treatment, I believe, is going to treat all three things. It's going to remove the fragments, going to change the chemical environment. And it's also going to be thermally ablating the small sensory nerves. And I believe that all three of these are best accomplished, at least at this point in time, with a washout with an endoscope, which can change the chemistry in the disc, remove the fragments, and ablate the sensory nerves. There's no question that a biological injection can change the chemical environment, as evidenced by the interview with Andy that you just saw a few minutes ago, as well as the evidence from the paper that 57% of people got a significant benefit from their low back pain. As far as the biologic injection goes, I'm not sure it really changes the fragment, but it certainly changes the chemical environment inside the disc, and it can also probably chemically ablate the sensory nerves with the hypertonic solution that's used to inject. In the future, as biologics develop, the need for surgery may decrease, and maybe a combination of surgery and a biologic injection will produce an even better result. Thank you very much. This ends the discussion and presentations on annular tears. Please feel free to give me a call at the office or look at the website if I can answer anything further for you.